Dr. Mena, I have another question from Charnel, and she wrote the following. So let's take a look at her question and see how we can help her. I'm having stiffness and pain in my neck. How can I relieve the tension without having to take medication? Is there a certain pillow I should use for sleep? And are there exercise techniques I can use? Boy, that's a great question. It's a loaded question, Charnel, but I love it. So let's start with the first one, doctor. She said she doesn't really want to take medication. What's your advice?
Fully agree. That's a very good question, Charnel. Fully agree. The less you can put into your body, the better. Typically, if I'm going to recommend a medication, typically it will be an anti-inflammatory medication to help you out during the episodes of the pain. However, we can mitigate this, or we can reduce your symptoms most of the time with an exercise program. Going to your next question, I believe it was about a pillow. I know that there's a lot of advertisements about pillows at mypillow.com and so forth. There's nothing special about pillows or mattresses. Normally what we recommend in terms of pillow for you will be a pillow that is comfortable for you and keeps you the alignment of the spine. By the same token, a mattress should be able to help. The mattress should be soft, should be comfortable but firm. Not a very soft mattress, because the alignment of the spine might go away, and that can increase a lot of the stress on your back. And then the final question, I believe, was about an exercise program. The answer is yes. An exercise program is the key here to help you out long term. The exercise program, normally, as I was telling before, the best way would be seeing a provider so they can get into a diagnosis of why you're developing the neck pain, and then getting you, depending on that, through a therapist, getting an exercise program. May take 1 or 2 sessions or 3 sessions just to develop the exercise program and for you to master those exercises. And eventually you should be doing those on a regular basis at home or at the gym. Good question.
And doctor, great questions, actually. And thank you, Charnel. What is it when we wake up in the morning and we just go, oh my gosh, I got this kink? I've always been curious about that. Like, what is it that it hurts so bad and it takes like 48 hours to go away?
Yes, good question from you. I guess that question is coming up from Olga Villaverde. So,
well, I'm normally a pain in the neck. However, I do get the neck pain. Get it?
Yes, pain in the neck pain. Very good. So the answer for our lovely host, Olga Villaverde, I will say that typically when you wake up in the morning, that most likely you were in an awkward position for maybe 7-8 hours, and you were either loading a joint in your neck, which are called the sacropophyseal or the facet joints, or you're putting a little more strain on the disc. And most of the time, they tend to go away. But I will say that there's some patients that even they wake up, that pain does not go away, and they persist with pain. And those are the patients that they come to see us. So normally what happens over time, the disc and the structures and the joints, they degenerate. They're not the same as when we were 14, 15 years old. And now you're putting a bit more stress on those joints in an awkward position for a prolonged period of time that will equal putting an unnecessary force on that joint or disc, and that can eventually cause an internal rearrangement or an injury within the joint or disc, and that will lead you into having symptoms of pain.
All right, thank you so much. And then my last question would be, do you recommend ice or heat? Or heat and ice?
You remember those questions from back in the days? Yes. So typically when you have an acute injury, normally the first 48 hours is ice. After 48 hours, then you can alternate either ice or heat, whatever is best for you. So typically will be no preference unless you have a contraindication to heat particularly. So people might be insensate, so they don't have any sensation feelings because they have a prior nerve injury, they had a stroke. So in those, you have to be careful about the heating or even the cold. But if you are able to sense yourself, so you have good sensation, for the most part, most of the patients, they will. So they normally will recommend using a towel to wrap the ice in the cold pack or the heating pad, and then just applying to the area about 15 to 20 minutes, and that should suffice.
Dr. Mena, have you seen an increase in people with back and neck pain as a result of the pandemic and being home, et cetera, et cetera?
Yes, I have. So we have seen that a lot. People are more sedentary. They're not as physically active as they're used to. Actually, I've seen people that they are like gym rats, that they go to the gym and all of a sudden they, because of the pandemic, they're not going, and they're sitting in awkward positions. They are not taking their frequent breaks. So all those things, they can definitely increase the musculoskeletal ailments, and those people, they can be at risk of developing injuries.
And have you seen an increase also in, say, sports athletes that have not been able to, hit the field and do what they love to do?
Absolutely. I have seen those. I have seen professional players from different NFL, NBA, etc. And yes, the answer is yes. They're not as physically active. They cut down on their training regimen, and unfortunately, they have seen setback as well. We all are humans, so everything starts by going back and strengthening and getting properly fit, and that will decrease the risk, reduce the risk of ailments and musculoskeletal injuries.
And Dr. Mena, is there a connection between, and I'm wondering, COVID-19 and back pain?
Not really. The COVID is not going to cause you back pain itself. However, you can develop, like when people are developing COVID, or they're actively having the virus, because the virus can cause myalgias and arthralgia. So myalgia means muscle pain, and arthralgia is joint pain. They can manifest as having back pain as part of their condition. But COVID itself triggering long-term back problems, the answer is no.
And Dr. Mena, for those that have not been able, like you say, to go to the gym, although things are improving as the days progress, athletes have not been able to get out there too. What advice do you give to help them get back on their game, if you will?
The advice is simple. Basically, if you have the time, and definitely you should look for a specific time in order to exercise at least 30 minutes a day. That'll be just good enough in order for maintenance at ease, and avoiding the conditioning, and eventually developing musculoskeletal problems in general, not only the back and neck, but also in general, like shoulders, knees, hips, etc.
And if somebody is at home still because of COVID, working from home, any advice to make the day just progress a little better in terms of, backache, neck ache? What advice would you give us? Get out of our chairs, walk around. What say you?
Yeah, good question. And I give this to the patients, that they same advice I give to the patients when they come. So normally you can put a reminder on your phone, and you can put a reminder between half an hour, every hour, within the hour, so you can stand up and decompress. So if you're sitting down for a long period of time, you're putting unnecessary forces on the different structures in your back, meaning the disc, the joints, and they might be suffering. Also, being in the computer for a prolonged period of time, it might lead you to developing into this position here. In that position, you're putting a lot of strain and a lot of burden in the lower segments of your neck. And also, you're putting a lot of like rounded shoulders that are also causing you can lead you into having shoulder pathologies. And also, being on the mouse, being in the computer, can also trigger carpal tunnel syndrome. So a lot of these things actually are what we call cumulative trauma disorders. And those things can be avoided if you can take your breaks and listen to your body, and decompress yourself every half hour to an hour.
I have about 2 minutes left, doctor, and I want to get these two questions in. I got one from a viewer here. Are you seeing people who are overdoing it now that they can go back to the gym? Are they like just now going and roaring in there?
About going back to the gym, of course. Definitely, my answer will be yes. If you have the chance of going to the gym, definitely I'll go for it, because you are actually exercising the whole body. So there's no wrong in getting back to the gym and being active.